All right, we're going to meet our panelists or contestants. First is Sabrina Anderson. There she is, Chief Executive Officer. Scattered applause. Yes, you can. There's the Boys and Girls Club. We'll see what you win, that toaster you need. A native of Louisiana, has been part of the Boys and Girls Club movement for 22 years. She has resided in Tennessee for the last 19 years. She started the Boys and Girls Club when she was 5. She serves on a variety of boards and organizations. She has a master's in education and Bachelor of Science degree in psychology, is married and has 2 sons. She loves to spend time with family, travel, and eat good food. And she also likes to hug all the time, right? She's committed to the Boys and Girls Club because she can see the true impact that clubs have on kids' lives over the course of time. She says we do so much more than most people realize, which is true and even expect. She has a caring staff who want to see our youth succeed at goals in life. They provide positive avenues for kids to grow into those productive, responsible, caring citizens we've been talking about all morning. So thank you for joining this esteemed panel. Juanita Jones. Hi, Juanita. Founder and executive director of Keep My Hood Good. It was established in April of 2009. She did it as a 15-year-old, right? The mission is to promote personal, civic, and community responsibility for undeserved, underprivileged youth through structured activities that encourage breaking generational poverty. She was born in El Paso, Texas, raised with both parents and one brother in McKenzie, Tennessee. She studied psychology and criminal justice at University of Tennessee at Martin on a baton twirling scholarship. So that'll help in the contestant part if you brought your baton, right? That's cool. But while she did that, she worked weekends at the McKenzie Police Department. Even though her dad was in the Army, she said, I'll show him. She joined the Marines. After receiving an honorable discharge, Juanita moved back to her hometown where she worked in a variety of roles, including starting her own transportation business, which led her to Keep My Hood Good, because she realized as she was working in the community that it gave her a vision of giving hope to the undeserved and underprivileged youth. She's also excited about what the future holds, and I know she's glad to be here today. Amy Jones. Hi, Amy. Not a whole lot of applause, but you got a few. Yeah. Sorry, yeah. That's right. She's originally from Lexington, Tennessee, which is somewhere, which is in the county that should be Lexington County, but it's not. No, you like to confuse us out-of-towners. She's called Jackson home since 1998. She holds an undergraduate degree in psychology from Union and 2 master's degrees, one in education from the University of Tennessee and one in conflict resolution from Lipscomb University. So she also rents herself out in marriages and stuff for conflict resolution. She served for 5 years as the director of the Madison County Court-Appointed Special Advocates CASA program, which, as a lot of you all know, is just a great program. It was her 13th year as the director of Juvenile Court Services for Madison County. Her background includes 7 years in human resources and community development with West Tennessee Healthcare. She has been married for almost 25 years and the mother of 2 sons, ages 20 and 11. A little bit of a gap there, isn't it?
You know, you make plans and God laughs.
That's right. That's exactly right. We personally know that feeling. And we've had some conflict we've needed to, but that's too personal. Sorry. All right. Lastly, Lindsay Carr, Southwest Regional. Yes. Whoa. She got a hoop there. Yeah. Southwest Regional Director of the Tennessee Suicide Prevention Network. She attended Bethel University, graduated in 2014 with a Bachelor of Arts in Human Services. Prior to her position with TSPN, she worked as a health coach at Pathways Behavioral Health, where she worked with individuals with mental health and substance misuse diagnostics and provided one-on-one coaching to help improve physical health. In 2015, she started a new role as a coordinator of the Jackson-Madison Prevention Coalition, where she focused on drug prevention. In 2019, she began working for the Tennessee Suicide Prevention Network as a Southwest Regional Director, where she works alongside regional volunteers to prevent suicide in Southwest Tennessee. Lindsay has worked through a lot of conflict resolution because she said she's happily married, to her husband, Tyler. Wave, Tyler. There you go. For almost 7 years, and she and her husband co-lead a college and young adults ministry in McKenzie, Tennessee. So thank you all for being willing to be up here and being grilled. And that little app y'all have, that's how you can vote on their response. You know, whether it's, no, I told them I was going to grade them. I'm just kidding. All right, everyone, you get to answer the question. Madison County ranks 95 out of 95 counties in the most recent Kids Count report. From your experience and perspective, how did we get here? Who wants to go first? Okay. Go, Amy.
All right, so if you know me, you know that I have a tendency to get on a soapbox, and I'm not shy on sharing my opinion, so here we go. Obviously, this ranking of 95th has rattled everybody, and it's not good, but I'm so glad to see everybody here who's trying to work to do something different. And it's a big, broad problem that crosses a whole lot of what all of us do every day. But I think having worked in the courts for the last 15 years, different roles, and I think what I have seen overall is sort of this shift in thinking that has allowed us to start to believe that certain segments of our population are no longer worth our time to try to change their trajectory when we see them going in a negative direction. And when you start to think that way, then it becomes okay to suspend children for long periods of time from school, and it becomes okay to put them out of preschool. And it becomes okay to just get them out of your way so that you can go about what's immediately in front of you for that day. And that's just an incredibly short-sighted way to function. Because when you do those things, when we place those children out of our sight and out of our mind, then why are we surprised when they show back up 10 years from now on WBBJ where they've killed someone? And I guess the other part of that is we have reached a point, I think, where we somehow think that accountability and rehabilitation can't exist together anymore. We somehow think it's one end or the other, and I just don't believe that. I think we can acknowledge what happens to people that lead them to negative places while still not saying that assaults and robberies and gun violence, we're not saying that's okay, but it is okay to acknowledge what led you to that place. And try to fix it.
That's a good, sobering response. Yep.
Exiting soapbox.
Want to go next, Lindsay?
I think a lot of these questions are very challenging to answer in a concise way. But I will say for me personally, something that I feel like has been brought to my attention a lot more, especially in the last several months, is the topic of racial disparities. Knowing that Madison County specifically is made up of almost 50% of a non-white population, and a lot of times we haven't had conversations about those disparities that do exist and how that affects things across the board. And that's with healthcare, that's with mental health care, that's with education. There's a lot of different disparities that exist, and I think for a long time those topics have just kind of been pushed under the rug and not addressed, even though, you know, in our society we would say we've made so many triumphs, and we have to an extent, but there's still things generationally that still exist that are a part of our community. And I think we're finally getting to the place where we're having to talk about these things because we're accountable maybe for the first time in a long time with the way that things are being shown and displayed across our nation. And so it's really something that I think we need to be talking more about as a community, is just not only the issues that we face as a whole population, but specifically looking at what are the disparities that exist and how can we help those disparities not be there and not be present.
True. Very good. Yep. Thank you.
In my opinion, that's my disclaimer tonight, we have several different aspects that cause issues for our community. And one of those we've already talked about is the inequality. You can tell that we have people that are not on a level playing field, and they never will be unless we invest, unless we help, unless we collaborate, unless we work together to help them and recognize that everybody has value. Our kids have value and other people have value. There's a breakdown with our family dynamic. A lot of people don't attend church anymore, whether they believe in God or not. But it started with the church. It started with having a dual parent home for our kids. There's a support system at the church. So I think that we have to work together to encourage people, to help educate people, and to help them rise up.
Thank you. Yep. Pass the offering plate.
We have been here for a while, and Kids Count data reflects it. In 2016, there were 5,900 children in poverty in Madison County. In 2019, according to the Kids Count Annie E. Casey Foundation, there were 1,771 children suspended from school in Madison County, and 1,480 were Black, and 1,094 were males. In 2018, and that was the school suspensions. In 2018, there were 225 court referrals in Madison County, and 171 were Black children. In 2019, remaining in state custody were 68 children and 68 youth on probation in 2019. Reported child abuse versus substantiated child abuse is a concern. In 2019, Madison County had 1,105 reported child abuse cases, and only 99 were substantiated. Main criteria to be substantiated are broken bones, blood, burnt skin, abandonment. And the people who call the hotline are educators, doctors, pastors, advocates, and concerned family members. I think we need to be accountable.
Thank you, Juanita. And while you have the mic, I'm going to pick on you. But just a reminder, you all can, if you have some questions that come to mind you want to ask the panelists, do it in that Slick little app. I don't remember what it's called, Slick or whatever it is. And they will compile the data, and then we'll make sure as many of them get asked as you can. Okay, Juanita, what led you to create Keep My Hood Good, and what has the work been like since you started?
I saw in April of 2007 that our children were not afraid to die. They were afraid to live. I saw how our children were going to jail or going to a grave. I saw children's parents encouraging their children to participate in a fist fight. I saw young girls having babies. I saw the boys wanting to be professional athletes, and the girls were wanting to be babysitters when they grew up. I saw the children had little to no parental guidance. I saw the boys were hustling just so they were not bullied for wearing out-of-date shoes. I saw a generational and a poverty cycle. And God placed it on my heart to help his children and I found Keep My Hood Good in April of 2009 in Lincoln Courts in Jackson, Tennessee.
Wow.
And
She got off her duff. Right? You got off your duff?
I did.
Okay.
I did. And what we have been doing since I started, we have served over 400 children. Most of them are working, post-secondary graduates, and military servicemen and women. We have 2 community gardens. We have painted 1 mural. We have a mom's club. We have a school suspension program. And we are still breaking generational and poverty cycles in families.
Amen. Cool. All right, you say in your mission statement that you promote personal, civic, and community responsibility to help these young people. What barriers have you faced or do you face currently in getting personal, civic, and community participation?
My biggest barrier, y'all, was getting the community to see my vision. Gathering the children, entertaining, educating, and exposing them was very easy to me because they are thirsty. The children want better for themselves. They have dreams but cannot capture that vision. So that was my hardest barrier, convincing the community of my vision.
Okay. All right, this is for Amy and Juanita. We all have been talking or aware of how we're on the bottom of school suspension, correct? So what's your assessment of the problem and what practical steps can be taken to address the issue? I think you have a partnership with the school district for the suspension, that you'll take those kids on suspension, or is that? Okay. So 2 questions. What's your assessment of the problem? In other words, why the suspension challenges? And what practical steps can be taken to move us up the ladder?
Okay, so I want to be clear. I do not think anybody in our school system wants to put children out of school. I don't think that's anybody's preference. So if you're here with the school system, please don't hear me as beating you up today. That's not at all what I mean to say. But I think that the folks in our schools, your frontline folks, your teachers, your guidance counselors, your principals, are bone deep weary of trying to educate children in an environment of near chaos. And so the easiest thing to do when you have struggled with that child all week, all month, all school year, and you just don't know what else to do, the easiest thing to do, send them home for the day, send them home for the week, send them home for the month. So I can get back to trying to teach the other children who need me. I think it is a weariness, and I think that's where, and that's what we hear a lot. We'll have a child show up in detention, and the SRO brings them in and says, well, here's what happened, and you look at the charge, and you say, okay, that doesn't really seem like a charge that would place a child in detention. But then you look at the history, and this is a child who's been wearing them out at school all year long, and they're tired, and they don't know what else to do, and so they send them home. And that's become easy to do, but as I have said to school representatives before, okay, but what are they doing once you send them home? Okay, you've now made them the problem of the person's house they broke into or the person they pulled the gun on, and I know that's not the school's responsibility, but it's the reality of what happens when kids are not where they're supposed to be all day long. And again, it goes back to that short-sightedness. I think recently we had a child who was put out of school for taking a gun to school, and that's absolutely right. I would never say that you should allow them to come back to school after something like that. But in this particular case, the child wasn't allowed to do online learning either. Okay, so now what we've done is ensured, because he was suspended for the rest of the year and he can't do online learning, now what we've ensured is that he's going to be right back in that same setting once his suspension is over. And we're going to be repeating the same thing. So what I would love to see, the practical answer that I would love to see, I would love to see our school board, our school administrators open up the doors and say, community partners, come in here and help us figure this out.
Yep.
The juvenile court has resources, Juanita has resources, Sabrina has resources, everybody, all of y'all in this community, y'all are doing stuff for kids and families. So make us part of these conversations. The answer doesn't have to be one way or another. It doesn't have to be they have to be at school or they have to not be at school. There are some answers that we can pull together. And so that's what I would love to see to address this particular issue of these long suspensions.
Great suggestion, idea. Jan?
I can just piggyback on what Amy has said. I'm not, with no disrespect, but this is just my view. I believe that the school system is affecting our children. They need to understand the underlying problems with our children. If a child is coming to school with a pillow and a blanket and goes to sleep into school, that should be an indication that this child is not sleeping at home.
Yep, thank you. Sabrina, as the director of the Boys and Girls Club, you've seen a lot of kids, a lot of families come through your program. What was it, 21 years? Is that what it was? 22. Oh, I'm sorry. I missed a year. What trends do you see in these youth and their development, family dynamics, and social abilities after 22 years?
For my kids, I want you to know where we come from, first of all. We have a site at Allenton Heights. We have a site at Lincoln Courts. We have an East unit, which is across from Kellogg's, and then we have our Isaac Lane Elementary School, and we service kids in Brownsville and Haywood County. Our young people, they're looking for love, consistency, and support, and they find it, I think, in a lot of the ways that we program and the staff that serve them. Those trends come from an extra need to be supported. I think for my young people, when they are coming to the club, they have their home away from home. They can have the things that they need. We're going to offer an academic portion. We're going to offer health and life skills. We're going to offer them more than what they would see in the street. For my babies, I think they look at us as examples. I think they look at us as the people to help them conquer their fears. So for us, these trends, support, consistency, and help, just the love.
That probably hasn't changed in 22 years, right?
No, it has not changed.
Yeah.
It has not changed. I think a lot of things with their educational level has changed. They do not have all of the support that they need at home. They don't have that village to help raise them, where once upon a time, if Juanita was having problems, my mom could tell Juanita what to do and how to do it. Nowadays, people are afraid to talk to other people's children and to have conversations with them for fear of backlash.
Yep. Good response. All right, any of y'all can answer this, and I would love the answer because it's a conversation my wife Kelly and I have, raising 3 daughters. So thank you. Before I ask the question, thank you for solving it for us. Children these days have access to social media and technology in ways that no other generation has. How many of y'all remember when there was no cell phones? There's all the Apple people raising their hands there. iPhone people. What has been the influence of social media on the kids that you serve? Any of y'all can answer that?
Everybody.
Yeah, all at once.
I'd love to just share a little bit about how it relates to suicide specifically, because that's the line of work that I'm in. I mean, you guys know that obviously social media is widely popular, and it's not just social media in terms of like Facebook, but it's things like YouTube and other video platforms. But one of the things that we've seen when we look at research that has been done about how social media impacts suicide rates specifically, There was a study done. How many of y'all watched or are at least aware of the show 13 Reasons Why? Raise your hand if you kind of know what that is. It was a widely popular television show that kind of featured the topic of suicide. And I won't get into the details of all of those things, but essentially they wanted to know what was the outcome of the people that had watched this show. Did it actually help individuals that were struggling, or did it actually perpetuate the problem? And what we found statistically across the board was for individuals, specifically young individuals that watched that show, that related to the main character, the more that they related in some shape, form, or fashion to the main character who died by suicide, the more likely they were to actually consider suicide themselves. It did not help the problem, it actually furthered the problem. And I've seen all kinds of articles that have come out. There was a young girl who was on YouTube Kids, which is supposed to be a user-friendly version of YouTube for children. And I know as parents, sometimes it's easy to say, oh, well, it's a safe platform, they'll be fine. But this young girl had found access to a video that somehow a person had put on that was not an appropriate video for the platform. They had bypassed all of the security and they placed a video, and it was actually a video of how to attempt suicide. So she goes to school the next day. This teacher notices the behavior in the classroom and says, you know, what's wrong? And this young girl couldn't say it for a long time, but eventually had drawn a picture of a young girl in a hangman's noose. And it was just very interesting to see that it really is, you know, that be careful little eyes what you see. I know we preach that a lot in churches, you know, people of faith. We talk about just what's taken into the body, not just food, but what are our eyes seeing, what are our ears listening to. And we know that those things absolutely have effect, and it's not just words that we say, but the stats prove it, that what we're exposed to definitely impacts us. And I'm not here to demonize social media per se and say that it's all bad, because it can be used for incredible good, but what is being seen is absolutely critical, that we're paying attention to how our young people are able to utilize those platforms in a healthy way.
Anyone else want to comment on the effect it's had? Go for it.
A lot of things that we see today is about depression, anxiety. Our young people look at the social media apps, for some of them, as how many friends do I have and what do other people think of me? You look at all the influencers. Our young people are learning so much more based on these internet social media interactions than they need to know. We can't always prohibit everything that they're going to learn. There's positives, yes, but there's depression, there's anxiety, there's cyberbullying that goes along with it. And I think that creates extra stress for our young people. You don't always think about children being stressed, but our kids are stressed because they're trying to impress other people. They want to fit in, and there's a lot of things that they're not going to be able to do. And so it's stressful for them.
Yeah, I'd add on, the children that we see who come through detention a lot, will, if you listen to them talk, they know a whole lot about why they're there and what led to it. And the biggest thing that I think I have heard from them regarding social media is that the problem of bullying, which has always existed, probably everybody in this room experienced it, saw it growing up. But the thing is, now you can't leave it at school. Bullying doesn't end when I get off the bus and enter my house. Now I've got this box in my hand where the people who bullied me at school can keep on bullying me all night long unless somebody in my household takes that phone away from me. It's never being able to escape it. And a lot of the young men recently, y'all watch the news, we've had a spike in gun crimes. And that's why a lot of the kids tell us they took the gun to school, because they were being bullied or somebody was trying to initiate them into a gang. So that's why they had the gun on them. And that social media has just made all that easier. It has made so much easier to prey on children. And that's why if you've got kids and they've got a phone, you've got to take it away, preferably, but if you can't take it away, monitor it. And I mean, you've got to be like a mama bear or a papa bear on that phone, because it's changing faster than you can keep up with it. And the apps are different, but you got to be watching.
So what do? Social media is not going away. Monitor it. Any other?
One of the lady in the audience said educate, but educate and limit it. Be aware and watch your kids' moods.
We have an audience question in relation to social media. Can you speak to TikTok trends and how they may be helping or hurting the younger generation?
Do your older people know what TikTok is?
TikTok brings a lot of humor to most people. You get to laugh, but there are also TikTok challenges that are really not helpful for them. I think the last one was the cinnamon challenge, about ingest however much cinnamon that you can before you passed out. It's not a good thing. Too much of anything is not good for you. So you have to remember that everything has a purpose, and you need to be aware.
I think the other thing I would add to that is a few Sundays ago, our pastor preached on, do you world-proof your kid or kid-proof the world? You can't kid-proof the world, so you better get after world-proofing your kid. You got to talk and communicate. And even though I've raised 2 boys, I'm halfway through the second one, they don't act like they're listening to half of what I say, but it's getting through there. And my older son, who is an adult now, tells me, I don't want to act like I heard you, but I did hear you. I heard you, and it's stuck in there somewhere. So, yeah, that's just monitoring it and keeping them off. Yeah, all that's great if you can manage it, but I think it's even more to just constantly be talking about stupid TikTok trends that get people killed and why that's a big deal and what do you think about that, and then listen when they answer.
Great advice. Those of you who are parents and work with young people, it sounds like the word is educate. Educate. Let those kiddos know what it's doing to them, and monitor if you can. All right. We're going to switch the order here because we're on this trend about nationally the suicide rates among children and teens have increased. Gun violence has increased recently in Jackson. Lindsay and Amy, are there any insight you can give into these numbers from your experience with youth, and why are we losing so many children and teens?
So again, specifically on the topic of suicide, if you do any research, you know that nationally suicide is the 10th leading cause of death. In the state of Tennessee, it's actually the 9th leading cause of death. And once you get into the age categories, suicide between the ages of 10 and 34, depending on which bracket you're in, is either the 2nd or 3rd leading cause of death. So when people ask me all the time, do we need to be talking about these things with our kids? The answer is yes, yes, and yes, and yes, and yes. The problem is, I think there's still so much stigma with the topic of suicide specifically and mental health, and I know we'll get into a lot of that later on this afternoon, so I'm not going to get on a soapbox about brain architecture because I saw it on the agenda and I was like, yes. But there's just a lot of stigma that's still there, and people don't know how to address the topic because it's really uncomfortable. And if I were to ask you guys, all of you in the room, how many of you are parents or grandparents in the room? If you are, raise your hand. Yes, almost everybody in the room, right? And if I were to ask you guys, and you don't have to actually raise your hand for this question, but if I were to ask you, how many of you in the room have had an active conversation about the topic of suicide or mental health with your child or grandchild? There's some of you that are proudly like, yes, I did it. Again, I'm not here to shame people or to say, bad on you for not doing that, because maybe you haven't known how. But that's the problem, is we don't know how, and then we don't do anything about it. We don't actually take action and start those conversations and learn ourselves how to approach that conversation with young people, but we have to. because children younger and younger and younger are dying by suicide. I know that with my position at TSPN, I think the youngest that I've seen in the last 3 years die by suicide is 8 years old. 8 years old. There's an 8-year-old that died. And it is wildly needed, and how we do that, I mean, that's kind of the question that people are asking. Well, what do we do then? Don't wait to have someone approach you about it. Be the person that is willing to say, hey, Lindsay, can you come and train our office staff? Or hey, so-and-so, can you come talk to us about this topic of mental health? Or hey, can you come address this specific issue, social media and how it affects mental health? Or whatever it is that you would want to learn about, take action and actually learn how to have these conversations. Because I think if we were doing that, we would see wide change. Data and stats show across the board, this is not a blanket statement, but a majority of people, a majority of young people especially, are not going to go to a mental health professional to seek help. Who are they going to? Y'all, friends and family, people that they're comfortable with, right? I've seen people across the board that would never step foot in a counselor's office, not because counselors are bad, but because they're still afraid of that stigma, right? So they're going to come to their friends, they're going to come to their parents, they're going to come to, another family member that's a little bit more removed. And when we don't know how to do anything about it, it's like having someone choking and not knowing CPR. We have to know how to address it. And I just highly, highly encourage you, if you've never had any kind of training on how to address it, please talk to me or anyone in the room that is a trained professional in these topics, because we need to start those conversations.
And how can we get a hold of you?
You can reach me via email. It's really easy, lcar@tspn.org. My phone number and contact info is on our webpage for sure. I also have an upcoming event that I'd love for you guys to be a part of. It's called Race and Resiliency and Mental Health Symposium. It's going to be on July 15th, and so that's another great way for us to all get connected, just be a part of a greater conversation about mental health. But definitely email me, call me. I have some business cards, so just come find me after we get done with the panel. I'd be happy to talk to you.
Thank you. Before you answer, Amy, it sounds like if we were a bunch of elderly gentlemen sitting around McDonald's, they'd say, this is so easy to solve. And you're saying, yes, talk to it. Bring it up. Don't make it a taboo subject.
Yes and no. It is hard because people want to know, how do I fix this? And there's not a black and white answer for everybody across the board. It's not going to be cookie cutter. Why people choose suicide, why people get there in the first place, it's a complex issue. You can't just blame it on bullying. You can't just blame it on social media. You can't just blame it on fill in the blank. It's usually a very complex thing, but we know that when people have support in their lives, y'all have hopefully all been through ACEs, right? And there's that balance of the issues that are being faced counterbalanced by the support and the protective factors that exist. The more that we can speak up and do things and be active in the community, the more likely we are to prevent suicide from happening.
Get off our duff. Amy, did you have anything to add to?
I would just kind of reiterate the same point, is we've got to normalize the conversation around mental health. Nobody's afraid to talk about their child having diabetes. Nobody's ashamed of that. Nobody's ashamed of a kid walking around in a cast because they got a broken arm. We've got to make the conversation around mental health as normal as it is around physical health before people are comfortable asking for help. And I'm going to be very open and vulnerable. My oldest child has some mental health challenges, and when he first talked to me about that, because of what I do, I thankfully knew where to go to get the help and, for him to be able to move past it. But my husband had a harder time with it. And he said, what do you think about all this? And I said, I think there are a whole lot of people in prison cells and graveyards who didn't know how to ask or who to ask for help in the right way. And I think that's the way we've got to teach everybody to have those conversations. Don't be ashamed of it. Don't wait until the worst has happened. If you have a kid who needs to see a counselor, Just make it happen. Let's figure out how to get that done. If they need some medication to get back to a level 0 where we can start dealing with the other stuff, let's make that happen. It's okay. It's just like you would take an aspirin or a Tylenol. We've got to get people away from this whole idea that it's bad or evil and something's wrong with you.
Yep. Very good.
We have an audience question related to that. Are there any suggestions that you have to make mental health more accessible, either systemically or policy changes that could make mental health more accessible, not just on the conversation level, but more on the broader scale?
I think for us, and it's surprising to a lot of people, but the families that we see who have the hardest time accessing mental health services are the ones who have private insurance. It's fairly easy to help a family whose child is covered by TennCare. There's a whole lot of providers. You can make that happen pretty easily. But just this week, we had a family whose child needed inpatient residential treatment. Well, their health insurance had behavioral health coverage, but had a $5,000 deductible. That might as well be $5 million for this family. They can't pay that. And we have some wonderful organizations. Pathways has I saw Kim Parker here. There's a behavioral health safety net that can help in situations like that. But I think it's teaching people where to go to ask, and it's remembering that this is an across-the-board for everybody thing. You know, even folks who have good paying jobs and good insurance covers, all that, they're still going to struggle with some of this because, you know, I don't know too many people who could just take $5,000 out of their pocket to pay for a treatment bed somewhere. So that's the community resources to help everybody.
Okay.
A couple of things that I would just add. She mentioned the behavioral health safety net. For those of you who may not know what that is, it's basically a pot of funding that helps uninsured or underinsured individuals receive mental health services. You guys may or may not know that exists. Hopefully you do, but if you don't, researching and knowing more about how to access that safety net is a big thing. Another big thing that people don't often utilize as a resource is EAP benefits. A lot of people don't realize that their healthcare provider and their insurance and benefits with their employer actually does cover them and their families. I learned recently that my EAP benefits actually cover not just me, but my entire family. And so if there was any need that I had as far as behavioral health is concerned, I would be covered, and so would anyone else that's a part of my family. So knowing that as well. But one other thing that's up and coming, and this is a whole topic in and of itself, and we do not have time to fully go there, but it's cool because for the first time in a long time, we're actually going to see a number 988 come out as the behavioral health national suicide hotline number. That's transitioning from 1-800-273-8255 to 988, you know, which is fabulous, 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 that if you were to have a physical emergency, you would call 911, right? If you have a mental health care need or suicide risk, things like that are going on, you would call 988,
Cool.
which is awesome. That'll be rolling out, I believe, next month, which is really cool. There's still a lot that's underway in that area, but we are going to see maybe some gaps close a little bit with people actually receiving help, because it's a lot easier to receive or remember the number 988 over the other hotline number, that's for sure.
Let's shift gears to another big area, single parents, or children being raised by single parents due to the divorce statistics and stuff like that. Any one of you can chime in on this. How does this change the dynamic of the youth that we serve, and how can the community mitigate the negative consequences of single parent children?
I always go back to church. I go back to our religious faith because there is a support system within the church that is wonderful and fantastic. I want our people to, I say our people because it's everybody, to understand that you have somebody that you can lean on. You have hope. You have a belief system. And I think for the divorces, I think they would go down if people would just continue to try to compromise, to work things out, to talk to each other, to communicate, to practice love, to practice kindness, to show that. You remember that love one another? You have to be able to show that love in a positive way. No, marriage doesn't always work out. But again, you do your best to make it work. The low birth rate for the families, I think that's just because sometimes people don't want people to know that they're pregnant. I think that sometimes that it's an accident, and Miss Margaret is here, and she would say a step ahead will help them with birth control issues. But divorce is something that is common in our communities, and people don't think of it as forever anymore.
Right. Anyone else? How can the community help mitigate these challenges?
I think we have to acknowledge that however a family became a single parent family, that single mom or single father is dealing with a whole lot of stuff. They're trying to work, they're trying to keep the kid in school, trying to keep their grades, trying to keep them fed, clothed, all of the things that parents do. And I think a lot of times when a child gets involved with the system, whether you're talking about DCS or the courts or whatever, here we come and we start throwing all this other stuff at her or at him that we want them to do to fix whatever the problem is. We want them to go to counseling. We want them to go to A&D services. We want them to do all these things, and it may all be very much needed things, but we're going to have to find a way to do that in a way that doesn't feel like we just backed a dump truck up to her house and unloaded all of this other stuff on top of her. There's some really innovative things being done in communities across the country. They're finding ways to bring all services under one roof so that she doesn't have to go here for a med-eval appointment and here for counseling and over there for some other social services type thing. That's easy. Transportation is often an issue. Finding ways that they don't have to drive out into the county, or that they have easier access to public transportation where that's available. There are some really innovative things being done, but I think just acknowledging that it is very hard and they're carrying a very heavy load as a single parent, and there are things that we can do to help without making it worse.
Excellent. That's a good transition into my last question, and then there may be some more from the audience. What examples from other communities do you think would be good for Madison County to look as we develop collective impact strategy? And what investments do you like to see our local leadership make in these areas? So other examples, and what would you like? I know there is some city and county leaders here. So what would you like them to do, or anyone else on the leadership end? So any other examples y'all run across that are doing well in solving some of these?
I know we advocate for this a lot as ACEs trainers, and they did not pay me to say this, so no worries. But I think the more that we can invest on the front end, the more we will reap on the back end. I know we tend to pump money into different areas, and the reality is if we could, I'm not advocating to obviously hurt any particular organization or part of our society, but if you look at the data, it is evident that the more that we can do in early childhood development, it is insurmountable or incomparable what would be the benefit of doing that. So I wish that we would take more of our funding efforts and pump that into early intervention. What that looks like, that's above my pay grade. You guys can all figure that out. But I do think that it would be wise for us to just find ways for us to intervene early, for sure.
Any other ideas or seen good models work besides your own?
I would love to see more cooperation, more working together between government entities, nonprofits, and school system and the faith community. I think that there are lots and lots of resources in the faith community who don't know how to get involved or have sometimes tried to get involved and been told that they were not welcome because they were a faith-based organization. And we did see some of this on the federal level several years ago. There were some changes in legislation that let faith-based organizations apply for federal funding and get involved in that way, but that's kind of fallen off. So I think especially locally, I would love to see more reaching out to the churches, because it's just, you ask people, why didn't you help? And they always say, well, nobody asked me. You can't just go out and say, we need your help. Okay, tell me, what do you need me to do? And most people will do it. But I'd like to see that on a broader scale between government entities and our faith community.
Sabrina, would you agree with that?
I absolutely would agree with that. And Amy Bechtel was over there raising her hand. Look at me, because she works with the state with faith-based initiatives, and she's trying to make sure that our community is involved and that we're reaching everyone that we possibly can that's willing to help, willing to collaborate, and step up and make it happen.
I think one other thing I would add, if I can, being trauma informed, I cannot say enough about the importance of being trauma informed. We were talking about that at our table a little while ago, but I think, obviously as a society, there are many of us in helping professions that are exhausted for so many different reasons, and we find every excuse to not treat children with kindness and gentleness because of the things that they're facing. But we need to make an extra effort to make sure that we are handling things appropriately and trauma-informed in our approaches to those students that may seem to be more disruptive or more, unruly in their behaviors and whatnot. I think that the more we can be intentional about seeing beyond the behavior and asking, what has happened to you is critical for us as well. We have to be better at that.
I think that we should study the generations. The millennials, they want to be seen. That's why they're tatted and body pierced. I think if we understand the Generation Z wants to be heard, that's why in the schools they're being vocal and being vocal to adults. And the Generation A, that's this new generation, I think that they are going to be, they're digitalized. Anything, any need that they have or want, it will be right there in front of them. They just have to push a button. I think if we understand their generations versus them understanding our generations, I think that would be a helpful tool.
Now you repeat those again. You had 3 generations.
Yes, there's actually 7 living generations right now. We have the silent generations, and the generations are from in increments of 20 years. So we started in 1901. But the most recent ones is the Generation A, Gen A. They are the little babies. Then there is the millennials.
And what does A want?
They're digital.
Okay, keep going.
The millennials are wanting, that's Lindsay, they're wanting to be seen. That's why they're tatted and body pierced. And then that Generation Z, they want to be heard. And these are the children that we're working with also.
And my generation just wants to hear.
You're silent. You're called the silent generation.
Sheesh, that would be nice. Okay. Any questions, Olivia, that you had? Yeah.
We had a lot of audience questions, so let me just say I will have some of them answered specifically on the app, so you can see that reply in the feed of the questions. Some of those questions we'll have answered after today's program. We want to provide all of the answers that we can, but we also are collecting them as we go so that we can use that in our work moving forward. So thank you for all your questions. I'm sorry we didn't have to have time to address all of them on the panel, but we will be answering them after today's over with.
Perfect. All right. Thank you, panelists. Y'all were great. Thank you. I've never seen so many heads nod while y'all were talking. So if it was a church, we'd go, amen.